So what are the mechanisms by which exercise affects high blood pressure? You can see I've got a reference to the chronic disease and disability text. So what are some reasons why, how does exercise make its impact? As I mentioned, it's not fully understood. So norepinephrine, neurotransmitters, your epinephrine and your norepinephrine, it lowers the vascular resistance in the fight or flight response. So that is one mechanism. We tend to have decreased norepinephrine with exercise training, and we have increased vasodilation. So, that would make sense. If you've got increased vasodilation, then blood pressure is going to be lower. Now, hyperinsulinemia. High levels of insulin can also affect high blood pressure. So affecting sodium reabsorption by the kidney, that also lowers vascular resistance. So we talked about on the heart disease lecture that high blood sugar can also cause injury to the endothelium. So if we get rid of high blood sugar, we get rid of high blood insulin, is that going to have an effect on blood pressure? And of course, better kidney function to look at the absorption of sodium and water. Exercise testing with any client who has hypertension. The client should take any medications as they normally do. So, we would never tell anybody not to take any medications. That is only a physician or other qualified healthcare provider who can do that. We can do any of the testing protocols that we have learned. Treadmill protocols, walk tests, cycle ergometer, YMCA. People with high blood pressure may need ECG monitoring because we may be watching for irregular beats, and we may be watching for ischemia if it is a clinical test in a doctor's office, a diagnostic test. And of course, we are definitely going to monitor BP during the test. ACSM gives cut points for terminating an exercise test of 250 millimeters mercury systolic greater than 115 diastolic. Now, this is for a clinical setting. In a health fitness setting, we would never let anybody get that high. I would terminate a test long before that is over, unless I was working in a clinical hospital physician office setting. And so this is table in the chronic disease and disability text. Again, follow your basic ACSM guidelines. So most people, moderate exercise is going to be really effective for blood pressure management. So 40 to 60% VO2 max, 40 to 80% of maximum heart rate. So that is going to encompass a lot of activities that are going to fall in that role. Perceived exertion, 11 to 13. Maybe you could go a little bit higher, maybe 14 on the 20 scale. So you don't want people going at really high intensity. Resistance training, basic ACSM recommendations can work for people who have hypertension. But if they are in the high hypertension, the 160 over 100, they probably should not be resistance training. No exercise at all if their blood pressure is greater than 200 over 115. So aim for 700 kilocalories, work up to 2,000 kilocalories energy expenditure per week. So those are numbers that have been associated with lowering hypertension in these populations. So 2,000 calories a week, so say walking, the equivalent of walking 4 miles 5 times a week. So it's a fair amount of exercise, but getting people to those minimum guidelines and having them get up to about 2,000 calories per week. The public health approach, this is a lot of the work that we are doing here from Eat Smart, Move More York County and our Healthy South Carolina initiative, getting people access to healthy foods and increasing opportunities to be physically active in the community by improving walkability and bikeability. So if you think about that, if we increase opportunities for more people, then that could have a long-term impact on hypertension. So that's one approach. And of course, the lifestyle modifications. Get people to lose weight. Adopt the DASH diet, watch their sodium, be physically active, and alcohol consumption. I don't think I had that on one of the other slides, but yes, alcohol consumption can also affect hypertension risk as well. So in summary, know the risk factors for hypertension, know the difference between primary and secondary, know the different diseases associated with hypertension like stroke, know examples of the types of common medications in hypertension, and we'll discuss in class lifestyle choices for hypertension and getting a client to work more on case studies to develop a program, and the role of exercise. What does exercise do with hypertension? And we will cover the sample question in class.